Hello, I have done a mistake. My presentation is in Greek, so you will have to put up with me. I will translate it live, of course. Yes, of course.
Sorry. Έχουμε άλλη μια εξ αποστάσεως συνομιλήτρια στο κύκλο τραπέζι, την οποία χίλια συγγνώμη, ξέχασα να την αναφέρω. Είναι η κυρία Δήμητρα Διονυσίου, επικεφαλής τμήματος τεχνολογιών υγείας, Sense Group, Ινστιτούτο Συστημάτων Επικοινωνιών και Υπολογιστών, από το Εθνικό Μετσόβιο Πολυτεχνείο. Θα είναι μαζί μας διαδικτυακά και θα μας κάνει μια παρουσίαση. Please again.
Thank you. So, for those of you who do not read Greek, you can close your eyes and listen to my radio voice. I will do my best. So, the idea is to have a fruitful discussion about e-health and cancer. I come from an institute, a research institute located in Thessaloniki, a little out of Thessaloniki, Thermi. It's called the Institute of Applied Biosciences. It's part of the Center for Research and Technology Hellas, which is a research center. We had the privilege of coordinating research projects across Europe, also for e-health and cancer. For example, we have very recently coordinated a Horizon project focusing on palliative care for hematological cancers. So we have some experience on that. I am an engineer by background, but in the institute there are a lot of doctors. We mostly work with leukemias, but this is not a restriction for us. So the challenges are many. The infrastructures are not that many. We need some lessons learned, and we need to build upon them. Now is the time. I know that, for example, in Greece, there are a lot of money being invested on e-health as we speak. When I'm saying a lot of money, I mean more than ever. So, for example, on e-health infrastructures, there are more than 300 million euros invested as we speak. These are European money, but these represent a great opportunity. It's on us to build on that or lose it. So, what do we mean by the term e-health, electronic health? We mean that we need to take advantage of the new technological developments on the computer science domain. The big question is for who. I couldn't agree more with the previous speaker. Typically, e-health tools are not built for patients, at least not so far. In Greece, the major e-health tool which has ever been built was the e-prescription system. The e-prescription system is considered to be a big success for Greek politicians. It was not built for doctors. Doctors were frustrated for years. It was not built for patients. It was built to save money. It saved money, but nobody liked it. But it saved money. So it's crucial to understand what we built and for who we built it. Is it the health system? Are the insurance companies? Are the payers? Are the healthcare professionals? Are the patients? The patients are the red word here. So typically this is not the case because the benefit of building tools for patients, the money benefit is not very clear in the beginning. You very correctly focused on the prevention of cancer, which is not easy to be measured. So you don't have direct KPIs, which could be measured in 3 years or 4 years, or in the term of a funded research project. So how are you going to convince somebody to give you 2 million euros or 4 million euros or 10 million euros when something else could save money directly? So this is a hard thing to do, to convince people. You mentioned AI. You mentioned that AI was not here 5 years ago. This is not entirely true. If you discuss with engineers, you could have an argument. But in any case, ChatGPT was not here 5 years ago. Okay. Hospital information systems are not yet everywhere, and the biggest issue is that they are not yet interoperable with each other. They could be in principle. The engineers have done their work. but there is a lot of management commitment to be invested here. Patient registries. Many people here come from Denmark, so they might be amazed, but there are no patient registries in Greece. This is a key issue. Nobody could build policies, not for cancer, not for diabetes, not for anything, if you don't have patient registries. You don't have information to make decisions upon. Okay, telecommunication infrastructures, if you asked somebody 10 years ago, he or she would say that Greece is at a good level. Now, Greece is not as good as the rest of the Europe, but this is something that it is already there. There is also another issue, quality assurance of the already established infrastructures. For example, there are many hospitals that have systems which are partially used. Sometimes a system is used in one clinic, but not in another clinic. So there is also an issue of quality assurance of why we have something, how we use it, what kind of data do we collect, and stuff like that. Challenges. Of course, funding is the first one. I'm a researcher, so no surprise on that. Training is a key issue. We find it in front of us in many projects. We understand that clinicians, healthcare professionals, and patients are not really there to use digital health technology. The doctors are there to treat their patients, and digital tools are just a tool for them. It's not their priority. We need somehow to get them on board. Okay, we need to convince them that digital health tools will be here for good. We need to convince them that the use of digital technology in 20 years will be something like using medicine, using something like drugs. Nobody can do medicine today without using drugs. Nobody will be able to do medicine in 30 years without using digital tools. Or at least this is my opinion. Another big challenge, the legal context. For example, in Greece, there is no legal context about sharing data. Please remove the term sharing. There is no clear context about using healthcare data. This is a big issue. We know that the European Health Data Space Regulation has come forward. We hope that this will be nationalized after all and will give some instructions, but still this is a huge challenge. Of course, mentality, which needs to be updated, I would not say changed. I think it should be updated, focusing on the three main stakeholders that I am seeing, at least healthcare professionals. I would put them first, not the patients first. Because when the healthcare professional, when the doctor says something, the patient will follow. Healthcare professionals are currently in the power position to guide the patient. We are not yet in a patient-centric healthcare system. Okay? So it's crucial for us now to have the healthcare professionals on board. Of course, patients will need to be to get on board as things progress, but now I would put a priority on healthcare professionals. And of course, management. Management of hospitals, management of ministries, they need also to understand why this is important, what the benefits might be, and then transform these priorities into policy making. I will not say much more. I was intending to introduce my colleagues, but I will leave them to do it themselves. I will give the floor to Christos. Ladies first, okay, but Dimitra is far, so I'm not really sure if she is connected. Stella, you should start.